In this segment, we're going to demonstrate a muscle energy technique to treat a first rib that is an exhalation dysfunction. Now, the anterior and middle scalene muscles attach to the first rib, so we're going to use those muscles to help bring that pump handle motion of the first rib back to its normal position. So first we're going to find the superior rib angle of the first rib, and with either my long or my index finger hook along that posterior rib angle, and then we're going to have the patient rotate their head a little bit to the left, and I'm going to get my elbow down on the table, so then when I engage that first rib, we're going to disengage the long arm of the first rib away from its costovertebral as well as its costotransverse articulation. Then we're just going to tap the patient on the wrist and try to tell the patient to push their forehead up against the wrist. 1, 2, 3, and relax. During that patient's contraction, I am engaging that first rib, and after that 3-second contraction, when the patient relaxes, I'm going to engage that rib even more. I'm going to have the patient take a nice deep breath in, and as they inhale, push up against your wrist, and then relax, and then add more tension on that superior arm of the first rib to help disengage it, and the contraction of the anterior middle scalene will pull the first rib back up into its normal position. We repeat this 3 to 5 contractions, each contraction for 3 to 5 seconds, and then reassess the motion of the first rib by checking the static position as well as its motion during the respiratory inhalation and exhalation. So a muscle energy technique treating an exhalation dysfunction of the first rib using the anterior and middle scalene muscles.